Now we're about to start looking at abnormalities in micturition, which will be focusing so much on what do they call it? Urinary incontinence, right? So before we start looking at the abnormalities, we want to actually look at the normalities. Okay, so of course it's good for you to actually know the normal so that you can easily know the abnormal, right? So micturition just have to do with how your brain is being able to control where you're supposed to put out urine and where you're supposed to hold back urine. Okay, so the normal micturition now is also known as normal urination, right? So it's a complex, it's a coordinated process. So it involves the nervous system coming in to control the bladder and controlling the urethra. Okay, should be a better picture showing the various nerve levels, all of that. So for this one, what we have is this, urine storage phase. So there's a phase when there's urine in your bladder, but you don't want to urinate, so you want to store it for a while. So urine is gradually filling the bladder. Okay, the detrusor muscle remains relaxed to accommodate more urine. Internal urethral sphincter stays contracted to prevent any urine leakage. So when you're having issues of urine leakage, is all these structures not being okay? Do you understand? So sympathetic nervous system dominates there, promoting storage. Then sensory signaling. So as the bladder is filling up, okay, signals will now travel via the afferent nerves to the spinal cord and the brainstem. So conscious awareness of the need to urinate arises. Okay, so decision to void is, if socially appropriate, if the place where you are is a very good place, okay, then parasympathetic nervous system, which is basically for relaxation, will come in, promote what? Anything that is stressing you to go out so that your body can relax. Do you understand? So sympathetic tone decreases, relaxing the internal sphincter. So somatic control via the pudendal nerve also relax the external sphincter. Okay, so bladder emptying phase is when all the sphincters basically relax. Is when urine will be expelled through the urethral tree, okay, until the bladder is empty. So if urine is not put out complete, that one is says incomplete. Okay, something like that. Okay, we'll look at all of them. Then post micturition is detrusor muscle relaxes, sphincter returns to their contracted phase, and the cycle restarts again. Okay, that's why you're able to urinate many times in a day. Okay, so this is how the normal steps or normal phase in urination to be should basically go like.